Yeah. Hi,
Distinct news. Okay.
Victor.
There's distinct news. There's health farm media,
Are they all
both
together in the same
independent.
call? Or I have to do one and then
No,
do another one and then
they
do
are
another one?
together. No, they are together in the same
Okay.
call. So the thing
Okay.
is, I'm just going to give them kind of like intervals to ask the questions. Sometimes it's not
Okay.
all the questions in that paper that they will ask because some other media outlets would have asked the questions, and I guess they'll
Yeah,
want
yeah,
to
yeah.
repeat a question. So
No worries. Okay.
okay, so I guess they've started coming. I'll start admitting them now.
All right.
Hi, Raymond. Welcome.
Hello, Bulu. It's a pleasure meeting you.
Yeah, it's a pleasure meeting you too. So we're just okay. Amina is on the call already, but we're waiting for the other papers to join. Okay.
It's okay. I'm on standby.
Hello, Raymond.
It's
Good
a pleasure.
afternoon. Yeah,
Good
same.
afternoon to you too.
Hi, Joseph. Welcome. Hi, Fatima. Welcome. Hmm. I guess we're waiting for just one more person, and then we can start.
Hi, Tifa. Hi, everyone. Good evening. Tifa, I'm thinking just because of time, maybe you want to set a time that we're going to start, whether we have the final person on the call or not.
2:05. We're definitely going to start by 2:05. So just like a minute, and then we'll go. We'll go on.
Sounds like a plan. Thanks.
Okay. So we're just going to start. I guess Tony is going to meet us in the middle of it when she joins. So, good afternoon, everyone, and thank you for making the time to join. My name is Bolwatife from the communications team at SCIDaR, and in this meeting, and I'll be moderating today's interview. In this meeting, we have Amina Abdulkarim, Associate Principal at Solina Center for International Development and Research, who is being interviewed, and we also have Victor, who is the Communications Manager for SCIDaR, who is the communications manager for SCIDaR. In this meeting, we also have Fatima Saka from Distinct News. We have Joseph Kadiri from ITV, and we have Raymond Ken Bata. I hope I'm pronouncing that well, from Health Farm Media. Toyin from Daily Independent will join us. Toyin from Independent Newspapers will join us soon. So this conversation that we're having today is a part of World Immunization Week engagement where we are highlighting SCIDAR's work and perspectives on strengthening immunization systems and uptake. And we are pleased to have Amina, who leads work across immunization and health system strengthening. So the format will be straightforward. Amina will give a brief opening remark, after which we'll open the floor for questions from the media. And just to note, this session is being recorded and we'll share the recordings and the transcripts afterwards for your use. I will now invite Amina to make our opening remarks.
All right. Thanks, Boluwatife. Hello, everyone. Good afternoon. I hope I'm audible. She already did the introduction. My name is Amina Abdulkarim. I'm an associate principal at Solina. I work within our immunization and PAT strengthening portfolio within the organization. And my focus is really like Nigeria, and a lot of our projects are implemented in northern Nigeria. I also do some work in like new vaccine introduction, and some women empowerment, gender related projects as well. But yeah, I think I'll leave it there. Thanks.
Okay, thank you very much for that introduction, Amina. Tony is joining us right about now. So we are going into the question and answer session. So we're going to rotate it around the media outlets that are present here. So we can start with Distinct News. We can go to ITV, then Health Farm, then Independent News. So each a question each on the particular thing for the interview and for Amina to respond to. Thank you very much. So Fatima, you can take the floor.
Can anyone hear Fatima speaking? I can't hear on
I
my.
can't ever.
All right, great. So
Hi
Fatima,
Fatima, are you
yes.
having network issues? You can just type on the chat if you're having network issues, and then we can move to the next and come back to you. Um, so I guess ITV is
Can you
going
hear me
to
now?
be next. Okay, Fatima, I can hear you now. Can we all hear her now?
Yes.
Okay, Fatima, please ask your question. Thank you.
All right, thank you very much. It's a pleasure being here. So I have four questions. First, um, please, can you briefly introduce what Solina does, Solina Distakres, and how this immunization week represents the organization?
All right. Thanks. So Solina, our full name is Solina Center for International Development and Research. We're a Nigerian non-profit that's headquartered in Abuja. And we provide support that's focused on health system strengthening through things like strategy design, implementation support, data analytics, research, but we also do capacity building. We operate, as I said, out of Nigeria, but we also have footprints in a number of African countries, I think over 13 of them. Um, And across all of these geographies, we work closely with government and partners to improve immunization, primary health care, and just broader outcomes, not just for health. We also do work in education, and gender, and also venturing into some other spaces. I think for us, the World Immunization Week is, I'll say, it's a reminder of why we do what we're doing, because a lot of the time, as we can imagine, the daily grind, as we call it, can distract from the why of certain things. But the World Immunization Week sort of serves as a reminder and a call to action as to why we're doing what we're doing, how powerful vaccines are in saving lives, but also for us to pause and actually ask ourselves like hard questions as to why children are still being missed, what's wrong in terms of strategy and things. So I think it allows for some reflection for the why, but also helps us like pause and reflect to figure out how we might position ourselves to do things better. Because obviously we're making some progress, but we're not where we should be. So yeah, I think I'll leave it at that for now.
Okay, okay. Can I go ahead with the second question?
Oh, so Fatima, we are rotating it around. So after your question, ITV asked theirs, Health Farm asked theirs, and then Independent Newspaper asked theirs. Then going back to you.
Okay, all right. Thank you so much.
So I guess Joseph, it's on to you now.
Hello? Hello?
Yes, you're audible, Joseph.
Okay, can I make a suggestion, which is, can we have each person just ask straight, and then the person knows his or her question has been answered, and then the person get to work immediately on that. I don't mind if Fatima continues. When she ends, then I start.
Yeah, that's a nice suggestion, but there might be repetitions of the same questions. We are looking to
No,
save time.
that's what everyone will listen attentively, so that when a question has been asked and it's part of what you have penned down, you don't have to repeat it.
Are we all
What
fine
is
with
it?
that suggestion?
Sir, I think there will be a follow-up in each of these questions. So I don't know your own questions. I think they should all do the way the organization wants. Sir, I don't know, because I have my own question. I
Okay.
don't know your own question. Maybe it will be
Might
the
allow,
same.
but I think Joseph's suggestion is if we allow, I think it was Fatima that started to finish her questions. The others can decide if they still have additional or follow-up questions, etc. That they still need to ask.
Okay, thank you very much. Fatima, you can continue asking your questions then.
Okay, thank you. Okay, the second question is with the World Health Organization, they reported that vaccine has saved, they gave estimate of 1.8 million lives that vaccine has saved in Africa annually, and yet many children are still yet to be immunized. So what is the center doing, the organization doing to strengthen immunization effort and to improve child health outcomes, particularly in Nigeria?
Hmm. Okay, yeah, I think vaccines are definitely, they are a preventive health intervention, and definitely the value is it cannot be overemphasized, as you already highlighted with the number from WHO. But also the situation is complex. So it's not is multifaceted in that, in thinking about how you address vaccination related issues. It's not just a one track solution. In terms of what we do at Selena, I think we take a more system approach. We understand that it is not there is not one road to fix the vaccination problem. There are a number of issues that sort of make it complex. And so what that means in terms of taking a system approach is we look at everything from the plan, because it's not just making the vaccines available, right? there are also like demand side issues around people even wanting or understanding why the vaccines are important and wanting to take the vaccines. And so we have interventions and programs that are focused on essentially figuring that out, because that also differs depending on the geography you're working. So figuring out what the concern is in the different areas that we work, and trying to help with co-designing with the communities, the right messaging, the right strategies, and using the right community gatekeepers to sort of push that message. Beyond that, there's the supply chain issue. So while vaccines are available as provided by the country in collaboration with partners, there is also making vaccines available at the last mile, that's at health facilities. And so that requires some work which also supports around tracking vaccine availability at health facilities. And considering that we're not fully digitized yet as a country, and consequently within our health sector as well, it requires almost manual tracking at health facility level that have infrastructure to store the vaccine. So we support that, tracking how much vaccines we have, what that means in terms of making sure that they restock on time, to have supplies to be able to reach their communities. But beyond like the basic supply and demand, there is also a coordination or well, I'll just say system level aspect of it, which is the only reason that the supply and demand side works is the fact that we have teams or coordination systems that use data from either demand or supply to figure out what needs to be done. And here again, we support by embedding ourselves, our teams at state level, at LGA levels, to join these coordination platforms, these decisions, and essentially support the states with making sense of the data. And it's not a world where we overtake the or try to supplant the work done by the states. There are a lot of experienced and capable people at the states, but it's more how do you sort of ensure that per time data is interpreted and used the right way and in a timely manner, and provide the sort of on the job capacity support or just technical support to be able to use and interpret certain data. All of that extends into how data is used in planning, deciding which areas to prioritize for campaigns or certain intensifications. Intensifications are sort of like spot interventions where you sort of concentrate on a specific location and try to mop up unvaccinated population within that settlement. So I think it's a multi approach. Our focus overall is simple. We try to help partners and government to move from the plans that they have and the aspirations that they have into actual implementation, and ultimately to get certain outcomes. We are, as I sort of stated earlier, not where we are, but not where we want to be, but there's certainly be progress overall. But yeah, that's the breadth of our support on vaccination programs.
Okay, thank you very much, ma'am. The third question is that from the organization perspective, what do you think is the major barrier in driving the high number of unvaccinated children across Africa, particularly in Nigeria?
I don't think that there is one answer to that. I think I sort of alluded to it. Is a complex interplay of different things. So there are in some areas, and in most areas in the north where we work, it is demand side, right, where people don't necessarily understand the need for vaccines. Vaccine is a preventive health intervention, which means your child is not ill, but you are taking vaccine as a way to prevent a vaccine preventable disease, which is typically like transmissible or transmittable. So a lot of times selling that is confusing to caregivers. It's easier to have malaria, and so you see your child is obviously ill, and so you go and take anti-malarial or whatever other medication is provided. It's easier to have your child experience diarrhea and then understand that to be able to stop those episodes, you need to take X medication. It's a harder sell to say there are certain diseases that your child is at risk of having. And so you need to take this vaccine as a way to prevent that, especially as a lot of the vaccines are injectables and just generally people are averse to injections, right? So I think that's one of the bigger barriers that we have, and understand the demand that's as a result of um, not very clear understanding as to the value of vaccination. There's a lot of work that's been done to change the messaging and make it a lot more in your face, but beyond in your face, understandable in layman's terms why it's important. But there are also access level barriers that affect the under vaccination or zero dose populations that we have. And access is a mix of geographic access. So there are some communities that are very, very far away from health facilities just by virtue of where they are. Whether they have like in the north specifically, so it's things like terrain. So they are in what we call hard to reach areas that are not very easily accessible because of the terrain is rough and very, very difficult to maneuver ultimately. Even in some places in the north, there are places that where we have geographic barriers that are as a result of like water bodies and things like that. But then there is also issues with access because of security challenges as well. And so those form like pockets of populations that are unvaccinated, either because they are nomadic populations in the north where we have like farming, that's like cattle farming populations, or even agricultural populations that move depending on the seasons and all. And so you see them here in January, in May, they are somewhere else because that's where their livelihood are sort of taking them to. And because we don't have very real-time population data of our people, it makes it difficult to track these movements and sort of follow them up. And so as a result, it's possible to miss them out entirely in micro-planning processes as well. And where you have security challenges where people are displaced from their homes, they're living in IDPs, or they're just in areas that you can't access because, well, they are under control of some extremist group, it makes it difficult to access. So I think the combination of all of this sort of make the vaccination coverage. I really apologize for my background noise if it's coming through. I'm in the middle of something, but yeah, the combination of all of this sort of make it difficult to properly or fully vaccinate our population in the way that we like. We also have issues with on the system side, which is vaccine availability, as I talked about with last mile distribution, but also health workers. There is JACPA syndrome that, whether we realize it or not, sort of permeates to the beyond doctors and nurses, which we know are the typical like culprits to like our lower cadre health workers, making their availability very limited, and so also limits the amount of stretch they're able to have to reach communities routinely. So I think the combination of this is what causes the under vaccination that we have. Useful to highlight though that there are a number of things being done to solve this, not just by Solina, by the other partners that support vaccination, but ultimately and more importantly, by the government as well. In terms of HRH, there's some thinking around like a community health workforce that is trained, local, and able to support with delivering some of these services. There is policies that help with essentially not sort of siloing the tax for vaccination to a particular cadre, but equipping other cadres to be able to provide vaccination services. As you can imagine, vaccination service is a specialized service because a number of them are injectables. I want to make sure that the person that is administering these injectables actually knows what they're doing in delivering them. For the sort of understanding like our population and things like that, while we don't have a census in place yet or any sort of administrative electronic data platform on the health system front, there's some work around like, I think it's called identification, enumeration, and vaccination. But the identification and enumeration part is already ongoing, which helps to essentially track on a name by name basis, like a mini census really, to identify children under 5, but also women of childbearing age and pregnant women, count them, know where they live, etc., as a way to be able to continuously keep track of their journey for vaccination, but also just health broadly, and be able to follow up, which is some aspect of what we're missing because we don't have data, we don't know where they are, who they are. So yeah.
Okay, thank you very much. And speaking about terrain, so I want to know, are you across this political zone of Nigeria, or
I'm sorry, I didn't
your
hear the
way?
earlier part of your question.
Okay, I said speaking on terrain, are you on the part, like, do you cover, is Solina know across Nigeria, that's the sixth political zone of Nigeria? I want to know whether Solina is present is right on ground, that people know these
Okay,
organizations.
okay.
And
No, I got
so
that. Okay.
my fourth question, that's the last. I came across a man, a elderly man. He's an elderly man, about his 40s, in his 40s, and he's blind. So I now asked what is the cause of the blindness. He now told me that it's cause of measles that caused it, because he was not vaccinated. He didn't get immunization during his child, uh, when he was growing up, and that is the root cause of it. And it's from southwest, something like that. So my second question and my fourth question is that what are the important mechanisms that this organization Solina is putting to improve community sensitizations and increase vaccine intake among the Nigerians, and also maybe some African country. So I just want to know the levels of the implementation that
Mm.
Solina has in sensitizing this group of people to increase their awareness, knowing that the importance of vaccine to the child and to the benefit of the health. So I don't know what strategy do you put in place to do that?
All right. Thanks. I think there's two questions. The first is like SCIDAR's footprints geographically. Yes, we are in present in all of the states. Have implemented one project or the other in each of the states. However, our immunization focus is really in northern Nigeria, and there's a reason for that. The split between northern and southern coverage, if you look at things like NDHS, is very different. We have southern states performing well over like 70% in terms of coverage for things like Penta 3, while we have like northern states, particularly northwestern states, having some 30%, between 30 to 40% in terms of coverage. So the problem in terms of if we had to prioritize would be northern Nigeria. A lot of our efforts are focused on northern Nigeria. Although while we do that, we sort of understand that it's not then to sort of take the South for granted. The fact that they um, figured it out then means that like they don't need some support to push it, like to get it a lot more, to get really solid coverage, say something above like 80-90%. As you sort of highlighted, there are still victims of vaccine preventable diseases. Just your example of the man with blindness as a result of measles, a case of measles that wasn't or that couldn't be managed because he wasn't vaccinated. So yeah, I think that's the thing about footprints and like why we are very northern Nigerian focused, at least for now. I think ultimately though, for community engagement and the strategies, I think we have learned a lot over the past decade about what works versus not. I think our initial approach, which we have changed now, was a lot of there's a lot of assumption that if people knew the value for vaccinations broadly, they would they would they would want to take it, right? That has not proven true everywhere, mostly because, truthfully, vaccination is not top of mind for a lot of people. As I said, it's like a preventive health intervention, right? And what we find works is less numbers or this is what this is good for you, etc. It's also what it prevents, right? So a lot of for instance, if you think about messaging for headache, right, or Panadol, it's less about oh, it's going to make you feel fine. If you think about the adverts, it starts with somebody actually having a headache, and then you give the person whatever medication would provide relief, and then you see the person happier, better quality of life, etc. Same thing with malaria, all of it. A lot of the vaccination messaging just comes from a oh, it's good for you type of thing. What we're realizing though is that it'd be useful to layer that with some information as to what it prevents, as you highlighted, things like blindness, paralysis in the case of polio, and that not as a way to be a messenger of bad omens, but as a way of actually communicating the consequences, if you will, of neglecting this. And especially because it's free, it's a free service, so like taking advantage of it. But beyond that, it's also who communicates the message. A lot of so there is like cultural sensitivities in the North, but also just sort of understanding the landscape and what they take as important versus not, and who they consider what they consider as important based on who is saying it. And so beyond the message itself is also the messenger, and equipping the messenger with the right information to be able to answer the questions. Because there's one thing to be able to be able to hire like community resource persons or community gatekeepers and say they should help like propagate immunization messaging. But once a community member asks one or two questions, the person is flustered because the person doesn't have the answers to the questions. So it's figuring out what's the best way to provide the information in very easily digestible ways that they understand and are able to repeat to somebody and provide like very clear messaging and uniform messaging across the board, but also figuring out who the right people are to push the messaging. We're learning that beyond health workers and the community leaders, etc. There's also just women. A lot of people attribute health messaging to like their mother-in-laws, their mothers, their grandmothers, because these are women that have gone through what they have gone through. They've had children of their own, etc. And so are wealth of experiences that people tap from and listen to. And so a lot of our steer or pivot for demand generation is using these women as like peer influences and motherly influences, equipping them with the right information and having them be the ones to propagate the messaging. We also understand that immunization in itself is not alone is not what is needed by communities. People want nutrition interventions, people want malaria medication, etc. So how do we ensure that as they are talking about immunization and also providing immunization services, we're also doing that in an integrated manner that also brings together services that people deem important, so that you're not just talking about immunization and just seems like you're tone deaf to the other needs of the communities. How do you ensure that as you've figured out the message, you've given it to the right messenger, you're also putting it within the suite of things that the communities are interested in, such that it's an all-encompassing thing and not just focused on the bit that you want to pass through. So I think those are some of the changes that we've started to make in the strategy design for essentially community engagement. And they started to yield results in places where we've tried the women-led peer engagements in Bauchi, in Kaduna as well. And so we're trying to stretch that across the board, across a number of states, and sort of see the success that we get there. Over.
All right, thank you very much, ma'am.
You're welcome.
All right. Good afternoon.
Yeah, good afternoon.
Yeah, Joseph Kadri is my name. I'd like to ask some questions. I want to be direct so that other of our colleagues will also have time to ask. So the first one is, how can communities in Nigeria move from being passive recipients of vaccine to active drivers of vaccine uptake?
I think I think it's first not taking the community or the community engagement aspect as an afterthought, right? Which is um, unfortunately sometimes how we technical people, the mistakes we sometimes make, which we are fixing and have started to fix. In the design of a strategy and trying to get like ownership for it at a community level, the community, the recipients, the beneficiaries, their input is necessary in um, where they want to take the vaccination service, at what time they want to take the vaccination service, what's comfortable for them, what makes sense in terms of getting it, and also listen to the challenges they are facing with accessing it. Or is the health facility far? Does it mean it needs to be outreaches? Outreaches is where you take the services to the community and sort of set up in a fixed post or in some location that people can easily access, right? So I think it's at that level from the planning up until implementation, the involvement of makes them feel like a part of it, makes them own it. As with anything, if I design something for anybody on this call and I come to your house and say, this is how I want you to do it, even if the question will be, like, how, based on what, right? But if there's been some engagement about, okay, so we're thinking about this, we think this is important, what do you think? Okay, so once we figure out how to provide the service, what makes sense? Should we come on Monday? Should we come on Tuesday? Is that when you are home? Because sometimes you design strategies and you fix maybe Monday as a service delivery day for them to come to the health facility because maybe that's what's easy for you, but you find that maybe that's the day that the community that's their market day. Nobody's going to show up, and you didn't factor that in because you did not consult them, right? In terms of the post where you want to set up to provide the vaccination service, you need to ask the community as well. So what makes sense? What's an easily accessible area for me to provide the services? I feel like all of those co-creation and strategy building that makes people feel a part of it also creates that ownership and makes them like active ownership, makes them your own advocacy champion for it because they feel like they're part of it. It wasn't just an afterthought that was brought to them, and things like that. And just generally, I think that that's the steer everyone is taking, including Selena, in figuring out that co-creation is part of all of the change around like behavioral science and like the human level component of designing anything and making sure that the design of a thing is not just the idea of the technical folks or people that will implement, but also there's some input from the beneficiary who you want to access it, what makes sense to get them there. I think it is that would sort of ensure a more active uptake of vaccination and sort of make them feel a part of it, especially because it's a preventive services are a harder sell. So it needs to make sense to them and it needs to be as comfortable for them to be able to access it. Yeah. Over. Sorry, did that come through?
Yeah. Hi, Joseph.
Can you hear me? Can you hear me?
Yes, can hear you now.
All right. So I said the next question is on trust. When there is trust in vaccine, you're going to have more people, make themselves available. So the question is, how can religious and traditional institutions be better engaged to improve trust in vaccines?
Mm. I think the answer to that is open communication and a lot of information sharing, and also their involvement in the co-creation as well, right? So it is we need to as a system, like step away from the jargon of things. That's the big English and stuff, but like sort of explain why things are important, what it does. And it does not necessarily mean that it will convert everybody. Truthfully, people are different. But it means that people will understand what it is you're trying to do at the very micro level. And with understanding comes why people say like when you have information, you're able to then make like very informed decision based on the information made available to you. So it is very intentional engagement with these stakeholders, understanding the role that they play. Like they're gatekeepers across the board. Nigeria is a very religious country. So understanding their role as gatekeepers doing very intentional, targeted engagement, meaningful engagements with them that answers their questions very openly and addresses like myths, concerns, etc., as clearly and as simply as possible. And then arming them with information to be able to answer questions that people might ask of them, right? Because you don't want to like say a lot of things that don't necessarily get to the root of things, and then you want them to be your champion when someone asks the first question and then the second question, and things are sort of then lost in translation, right? So it's open communication, it's intentional engagement, it is very open, like even the design of it, getting their input as part of it and not as an afterthought as well. I think those are some of the ways to get them involved.
Okay, so thank you. Now, moving on, it has to do with the facility and health workers, facilities and health workers. So I now ask, what role do community health workers play? What role do you think they can play in bridging the gap between health facilities and underserved population?
Mm.
What role? Yes.
Okay. It's a mix of things. Community health workers is a broad term because there's some of them that are actually equipped to provide services. Uh, like the JHUs, although for our own health system, the JHUs are practically um health workers, so they're in health facilities providing services, etc. And then there are those that are not that don't have the qualification to provide services. So I think based on that, there's a broad set of things. Um, Generally, I think there's an assessment we did in 2024, right? On zero dose, where we found that health workers, especially those at community level, were trusted information sources for health and for vaccination, right? Um, a lot of the time we assume that these community health workers are already furnished with the information. So a lot of what I would say is like a lot of what I've heard from me is like information, just clarity, and ensuring that your foot soldiers understand what it is they are trying to do. So there is giving them training and training in ways that like communicates very simply like the benefits of things, not just the technicalities of administering the vaccine and all, but like why it's important, why people need to take it. Because a lot of the people that they listen to at community are these people because they don't know difference between community health worker and doctor. If you go to communities, even pharmacists, they call them doctors. So those are people they will go to for health advice. So you need to be sure that like you're providing them like the full breadth of information to be able to answer that. That's one. Beyond that, there's the referral services for those that are not able to provide vaccination services. A lot of these community health workers enter the homes of these communities almost weekly, monthly, interacting with them, playing with children of the households and all. And so they know these people. And so they are an immense resource in even mapping where these unvaccinated or undervaccinated households and children are. And because they already have the trust of that household, sort of getting them to come to the health facility and telling them which health facility to come to. So there is first the need to sort of map these community based health workers. A lot of work has already started on that, I think, from the MPHCDA. But having done that, it sort of anchors them to a health facility and ties their allegiance somewhat to a health facility. And that then helps with when they access communities and interact with the communities and provide very informed and clear information on vaccination. They're able to follow that up with this is where you can take it. This is where I think you can go and get vaccination service. So I think those are ways to sort of maximize the influence and access that community health workers have already within our community.
Okay, so I just have 3 more to go. This will be very brief. You know, the issue of misinformation is really a killer. So how can misinformation about vaccine within communities be effectively countered? Sorry, I'm particular about communities because the whole work, about 95% of the work for vaccine is in the community. That's why I am really focused on community. So if you get that question right, you can go ahead.
Okay. I think the only way to counter on truth is with truth, right? And to counter it with truth that is verifiable and that is human, right? I feel like sometimes in explaining that is human and clear. I feel like sometimes in explaining vaccine preventable diseases and the need for vaccines, people get too lost in the numbers of things. Also, because for instance, even the stat that we started this conversation with, around like 1.8 million children are saved in a community, that doesn't mean anything to them, right? Well, okay, 1.8 million, good for them, right? But if you have a human story and not to use a not to what is not to milk like a bad situation. If there are people or examples of how the absence of vaccine has sort of forced certain ailments and all. That's more relatable and clear, right? And also in countering myths is also not to shy away from the hard parts of truth, right? In trying to make something acceptable. So, for example, if you take vaccines, or if anyone that we know has taken vaccines, there are typically sometimes adverse reactions to it, whether you have like swelling at the point of injection, or sometimes the child falls ill um, overnight and is better the next day. You need to be open. You need to put all your cards on it. This is what will happen. This is how to manage it. Like in developed countries, as part of the vaccination regimen, they actually give you painkillers, pain relief. So paracetamol, Panadol, or whatever other analgesic to help with some of the after effect that you may or may not face, but they are proactive about it. So it's not a hidden thing that will come and that you come and have to face later on, right? We don't have the resources in that way to be able to provide both free vaccination and free um, um, pain relief at the scale that's to everybody that takes vaccine, they get an equivalent. But in a lot of the more equipped PHCs, they are able to, if you do have like adverse effect, you can come back to the health facility to access pain relief at a subsidized price or free, depending on the system the health facility is operating. So it is being open in that way, so that when you say, so that it's not like you're trying to trick people into things, and by the time they then take the vaccine and then they have an illness because they were not informed of it at all before, it then seems like a big thing, like something that was hidden, because they then tell the next person, my child was fine, I took a vaccine and then my child was ill, or was crying, or the place was swollen overnight and stuff. And so that's then a reason for other people not to take. But if you're being very clear, very open about what the realities are, and also providing what the remedies should be very clearly, and using human stories to communicate why certain things are important, it is easier, because then you know you are prepared for it. You are not blindsided by anything, and then it feels like you were tricked into something. I feel like that's the best way to be able to handle like myths. You answer it with truth, you answer it with human stories, and you answer it with like the complete truth, the end to end of it. It helps with being prepared. It helps with full acceptability, and also just ultimately it's better in the long run. Yeah.
Okay, so that takes me to the issue of doses for vaccine. I know that pentavalent vaccine is about three doses, and the current malaria vaccine is 4 doses, and basically the vaccines are in doses. So the challenge is with completing the dose. So what the question now? What practical step can families and caregivers take to ensure children complete their immunization schedules or doses?
I think the practical steps are really things like reminder systems. For our health system needs to be one that is more um, um, And I think it works that way in like private hospitals, right? Not so much in public hospitals. And I imagine it's a mix of the burden of work and the fact that we're using very limited resources to try to do a lot and stuff like that, right? But it needs to be a lot more almost person to person, so that if you have a client and the person misses something, like there should be a way, and there is a way, just the extent of the implementation is what is in question, to follow up, to call or to check on the client to make sure, okay, why did you miss, what's happening, and all. I think the systems that we have currently in PHCs is what we call it's a tickler bag system. Maybe it's a bit complicated to explain, but essentially for every session that is missed, your card is placed in the month that you missed the session. The idea is when your community resource comes to the health facility and they see a number of cards in March, for example, it means that those children have missed their March schedule. That person is supposed to then pick the set of cards from that pouch and then go and find the children and get them to come to the health facility again. I think this goes back to the wealth of resource that we have through our community health workers, because of the access and the trust that they have within communities to be able to do this house to house thing and get them to come. So I think it's strengthening that system, right? There is potentially through the work to digitize our immunization records, that helps you be more real time with the data. So if a child, if Amina goes to the health facility, and the next 4 weeks she's due for a vaccination, I have a system that prompts me, because it's one thing to it's quite a manual task to go through the number of child immunization cards that you have and try to like organize them in the pouches of which month they are due or not. But if you have an electronic system that sort of reminds you, it's easier to then say, oh, okay, it's time to prompt this person or to prompt that person. So I think it's the more in-person level, almost a person-to-person relationship with the clients that is required, and it can be enabled through the digital switch that we're making. But also ultimately, we need more investments in like human resource training of the community health workers and tapping into that resource a little more, to be able to make sure that there's very close follow-up for the vaccination, the subsequent doses of the vaccination, because life happens, like things, different priorities come up that might mean that that's not what is top of mind for the parent or for the guardian. But the fact that it came for one or two means that like ultimately it's something they're interested in. So you just need a little more to be able to get them, to remind them and get them to come back to the health facility to get the service. There are also things like outreaches where instead of coming back, because sometimes it's distance, instead of having to do the long haul of bringing your children after you've gone to work or markets to the health facility, there are, in terms, if you plan the services well, you're able to be in the community on days where a lot of the parents are home, and so you brought the service closer to them, and so that helps with sort of the burden of doing the travels to the health facility and things. So those are some of the practical ways of getting them to complete the required doses for vaccination.
Let me ask
Over.
the very last question now. Thank you so much for your time. The very last one has to do with a piece of legislation or policy from government to ensure that communities are empowered to take ownership of immunization programs. Because as we speak, what we do to community leaders and general leaders is to appeal to them, advocate, and tell them, please allow this thing to work in your community or in your domain. So the question is, what kind of policy or piece of legislation do you think we can have to, support communities to take ownership of immunization programs?
I feel like a policy is very straitjacketed. Also because seeking any kind of health intervention is the prerogative of the parents, right? You can't force anyone to do anything as it relates to their health, at least just based on how societies are run. I feel like putting a policy, even if you did have a policy, you need to then have a way to enforce it, and that then creates you can cross the line of then creating animosity towards the intervention, because you are instead of communicating why it's important, you are forcing it down people's throats, which might create the adverse effect of what we're trying to, or the opposite effect of what we're trying to do. I feel like it's less policy. Ownership needs to be bred on understanding, on a shared understanding of why something is important, and a trust that human beings are logical, right? If I come, although of course there are behavioral nuances to it about like what will make it easier for them, and that's things around the nudges, like reminding them to come take the vaccine, making it easier for them to access it by taking it closer to them, etc. But you need to, I think the focus should be on trusting that people will make the best decision if you make the information available to them, and then creating systems that make it easy for them to access it when they need to. I feel like the rest will be easier. Legislation will just create there's first, it might be easy to create whatever it is, but then you need to enforce it, and just the negative, or the way people might perceive that might make it like tricky. So I will not I will my own path to getting people to take ownership will not be a policy direction. It's more how do we make people own it? And if it must be a policy type thing, maybe not a policy, it's more like a reward centric thing. So if you take vaccination, or if you're a family that has record of like or a community maybe that has like a very high vaccination coverage, how do you make other social or economic benefits available to them? Maybe if you do an analysis as an LGA chairman, as LGAs now have some autonomy and have monies available to them, if there's X community that has consistently had like vaccination coverage above average or above the others, is that where, for instance, you want to put a new borehole? Is that where you want to, things like that, when you're trying to make a decision on what to prioritize? Although I know that there are other considerations around like where needs what areas actually need water versus not, and that might be more important than the vaccination coverage. But I'm just saying it might be a way to incentivize ownership of a thing, as opposed to sort of making policies or laws that enforce it. Over.
All right, thank you very much for your time. Let me leave the floor to my other colleagues.
Thank you.
Thank you, Joseph. Raymond, I think you can have the floor now.
Okay, thank you. Amina, you have been very, very, very helpful. But also, I will start from the macro down to the micro in my questions. So please be patient with me. The first question comes this way. Poliomyelitis, before poliomyelitis, there was smallpox, and certain steps were taken by certain organizations to ensure that smallpox has been eradicated, at least around the world. And we have the case of poliomyelitis, and there are organizations that stepped up to the challenge and have reduced it to the barest minimum. Now we are faced with the issue of immunization. And I know even concerning poliomyelitis, I want to commend SCIDaR for being able to implement some policies like the RES, being able to reach every settlement to make sure that certain people that were isolated still got access to poliomyelitis vaccination. How can SCIDaR reduce the number of zero dose? There are 2.1 million children that have never received vaccines before. Are there plans by SCIDaR to be able to reduce this number of children from 2.1 million to the barest minimum? And if there are, please share with us.
Okay. Um, I think you've highlighted a few I think overall, right, the more infectious a disease is, the more aggressive the response to addressing it is, as with smallpox, polio, with COVID, for example, right? Um, in terms of what we're doing specifically to address zero dose, and zero dose is children that have not received a single dose of Penta, um, there are a number of things that we have. Sorry, excuse me, 1 second. Yeah, so there are a number of things that we have done to address it across the states that we work in. We implement. I think you already mentioned one of them. Rest. That's the reaching every settlement. We implement a number of strategies that try to address it. I think first, what we've done across our states is like a robust assessment to understand the why, right? So we know that there are zero dose population, the numbers are high. I think we have the highest burden in Kano. Um, but it's then like, why do we have zero dose populations? And so we did an extensive engagement within communities, asking questions, focus group discussions with traditional leaders, etc. And I think overall, what we came out of that engagement with is, I think a lot of that has informed a lot of my responses here, is there is a people know what vaccine is. People just don't know like why they need to be vaccinated, right? That's one. But there is also the push for understanding why vaccine is given as a standalone thing, right? When there are other things that are pressing for them. So people need food, people need free drugs in terms of malaria, etc. Right? So there is all of that. There is also the myths and like misinformation around what vaccines do versus not, and all of that. So in designing so we took all of that information and they differ, or the overall they're the same issues across the states, but the extent for them vary across specific states. Was then taking all of that information, all of the various nuances around the why they are zero dose population, and then using that to design strategies. And we started to implement in a couple of states, and started to see results in those states. The issue, however, is for zero dose and vaccination coverage to improve generally, it's the the campaign, or it requires a concerted effort, right? It is not it is not something Solina alone can do. It's also why a lot of time when we do our assessments, we share it at state level so that other partners can see what we're finding. We share it at national level so that other partners can see. And some partners also do same as well, because all of those insights, maybe some questions you asked, I didn't ask. Same thing with this interview where we have multiple people asking, right? When we put together all the information we're getting from all of the assessments, it helps us paint a better picture of what the issue is, and then be able to provide a solution that sustains, that lasts. Um, so yeah, we have started to implement based on our learnings. We are reaching zero dose populations in Kano, and across the other states. Um, and getting some results based on that. So I think yes, the journey has started. It will be a long one, because even as you take this set of children off zero dose, there are children being born every day, and you need to engage the communities, you need to engage the parents to be able to make sure that like they understand why they need to take the vaccine. So it's a continuous, it's not something you do and you rest, right? It's something that needs to continue happening. And you need to continue to tweak the strategies to meet the needs or the specific root causes in the various geographies that you work in. So yeah, it's something we've started in collaboration with partners, in collaboration with state government, and something we'll continue to do. Yeah, I hope that answers.
Okay, I know some information there is proprietary, you wouldn't want to delve very deep, but it's okay. I still want to look into what part, you said the northeast part of Nigeria is the one very prone to, like, very challenging reaching the population there for immunization. Am I right?
No, I know Northeast is where we have like a lot of our security challenges, but data-wise, Northwest is where we have like lower immunization coverage.
Okay, are there prevalent cultural and religious practices that are hindering access to these populations for immunization?
Not in my experience, right? I feel like the whether it's cultural or religious, all it needs is like clear understanding of why they feel that way, and the information you counter is because, for example, a lot of the assumption, for instance, is and excuse me, a lot of the assumption is, for instance, say mothers are not newly a woman that just newly put to bed is not allowed to leave the house to access. It's part of like custom in some northern states where she's expected to stay at home and all of that. However, for those same women, when there are campaigns or when there are like vaccination interventions that go to communities, they take vaccines, right? You hear things like, oh, the father does not permit vaccination. However, when you have engagements with the father through like mosque, or I think we call them community dialogues in some states, where like you pull the men together, you have them ask questions openly, you see them uptake the vaccine. So I think I don't think there is a peculiar cultural or religious thing stopping any region really from accessing. It is more, have you understood like the why for them, and then how are you answering that question? If not, you're going to, if you don't scratch the surface, you will not solve the problem. Just assume, oh, that's why they're not taking it. But if you try to understand it and the reason for it, for example, the reason that women are not allowed to come out in some, not, is because they want the mother to rest. It's not because like she's under house arrest or anything like that. But is then, if you understand that, how are you then bringing the service closer to her, right? If there is someone that she trusts, how are you making sure that that person is the person carrying the message? It just requires more critical thinking for the solution. So there is no one size fits all solution to a problem, or specifically to a vaccination problem. It is understanding that, internalizing it, and then actually seeking to understand their perspective and designing solutions that fit them. But if you pick the solution that you think works in area X and you're trying to then apply it to area Y, it's not going to work.
Okay, thank you very much for that. Also, let me proceed by saying most of the times during immunization, we see it as a thing of like maybe it's a public holiday kind of thing. So you get to see health workers wear uh, their vests and walk in crowds, going home to home. And before then, maybe you might hear the National Orientation Agency or maybe the information desk of the governor announce that these people are going out, giving vaccination, give them your full support. But it doesn't really boil down to the rural areas. You find out that the local governments and most state governments are not really involved with the immunization process. I mean, how can the state and local government make it easier for health workers to access these populations that need these vaccines very much?
I think in terms of state and local governments helping health workers to create access, um, it is around like providing resources to that facilitate it. So for example, in hard to reach areas, making the funding available for them to be able to take, whether it is bike or in some cases there is a riverine area, like take the boat or whatever to access the area. I think that's what they can do, like the funding to access the area, so that it's not just the easy to access urban areas where a lot of the drives or vaccination activities happen, is resourcing that routinely. And thankfully, with autonomy, the LGA should have more resources to be able to facilitate that. I think beyond that, it is also the LGA and state governments taking ownership. I think we see that a lot at the state level, maybe some more at the LGA level, taking ownership and driving accountability for it, because we're human beings, right? We tend to respond to what our leaders or our immediate supervisors, bosses are interested in. If the body language of the LGA chairman, of the governor, of your direct manager, the OI at the health facility is one of not accepting mediocre performance in terms of like coverage or the outputs that they get from vaccination interventions. Of course, the people reporting to said supervisor or OIC or LGA chairman will do more. right? So I think that there's an accountability piece that that can happen a lot more at LG at state level to be able to drive it. In addition to supporting with resourcing as well.
Okay, thank you. Thank you for that. Okay, let me move to this issue of false narratives. There was a time that there was this narrative, I don't know if it's true or not, that the United States had to use through health workers that were giving immunization to access the house of Osama bin Laden and was able to gain information that led to his subsequent elimination. Um, there are also some other local narratives. Is there any, being a research and development institute, is there any program that SCIDaR has come up with to be able to counter false narratives that are surrounding vaccinations and immunizations as a whole?
I think for us, it's really, as I said, it's like truth and the whole truth and using the right, gatekeepers or entrance community gatekeepers to pass that information. Myths and concerns and conspiracy theories will always exist, and they're not. To be fair to people, they're not born out of thin air. As people say, the smoke without fire. It's because something suspicious, curious has been somewhere before in some place that necessitates um, or caution to certain things. And the way to counter it is to be forthcoming with what it is you're doing, what it means, what the end to end of it. Don't give people half truth. Don't treat people like they're not they don't have the full faculties to be able to make decision if you give them the information. Give them the information, trust them with the end to end information, put the information in simple to understand ways, pass it through the right channels of people that they trust, and all, of course, having first equipped those people with the right information, and that should address it. Myths is countered with truth. That's as simple as that. But it is being able to trust the communities with the full spectrum of it, and providing them ease to be able to access whatever service, whether it's vaccination or anything really you're trying to get them to buy into or use.
Okay, and as a follow-up, the health workers also are also agents that you could use to be able to counter these false narratives. How regular are their training and how effective are their training in being able to carry out these duties?
I think interestingly, health workers are trained a lot, especially in the states that we operate in, and not just through SCIDaR. Like there are a number of partners, immunization partners that conduct routine trainings, at least in a year. Health workers in the states are trained on one thing or the other. I think the other thing, as I said, is beyond the technical bit of the training. It is we need to simplify it a little more. We need to use like job aids. We need to create videos, easy to videos like with messaging that is very clear, human. We are a I was going to use the term why dancing community apparently. So the more you need to package your information in easy digestible ways. If it means people, I don't know, dancing to help with understanding the information. I think they do things like I think they call them, oh, I forget the term. I think it's like community dramas or stuff like that that happen as a way to make the information real and relatable. um there is like short WhatsApp videos, there is like SOPs, pictorial SOPs, guides and stuff that we should incorporate as well, because lots of time people that were training are adults. Like it's not the didactic, just reading like a bunch of stuff to people might be a lot sometimes. So I think it's there's trainings, yes, but it's then how do we move with the times and with the needs of the people that we're training to make sure that the information we want passed across is being passed across in the most simple and understandable format, whatever that is, to help us get the goal that we want at the end of the day, which is understanding clearly enough for the health workers such that they are able to transfer the information they have to other people very clearly and are able to answer questions or concerns that those people might have.
Okay, and finally, as a follow-up to that same question, um, we know that most of the time print media is mostly for the literate and for the middle class or the educated. And I don't know why most of the information that rovers around the challenges that immunization and health workers face in getting access to the hinterland populations for immunization is not really well publicized. People are not as people are not very conversant with these challenges, and people don't know how to help if they want to help, or if they want to get the training to be able to help out. How effective is the publicity that has been utilized by SCIDaR or by related organizations to assist in better in improving the figures of the immunization?
I think there are a number of channels. So, for example, for immunization and in terms of permeating the hard to reach and maybe in some cases those that are not English literate. There are things like radio jingles that are, and when we do surveys, we find that like radio, the health workers themselves, so almost like word of mouth, are the sources of vaccination information, right? And I feel like we do those well enough, especially like around like huge campaigns and all. I think the where we what we can do better is the continuity of it. So we should not make demand generation an event that accompanies something. It's supposed to be like it's like an ongoing thing because you need to continuously make the information available, answer the questions people want answered, like get feedback on the answers you provided, making sure that um, they're getting to the heart of the matter for those that are asking the questions, and then if need be, like pivot or reframe your answers or provide the answers that helps like hit the nail on the head for them. So I think it's not that they don't happen. I think they do happen. Sometimes it's just very is organized more as an event type thing. It's more episodic, so it needs to be a lot more routine, a continuous process, such that it's almost something that is a running commentary in the back of your mind around what it is, what it does, etc. And yeah, in that way, it will allow for um, it would penetrate all the areas and geographies that we need it to, and it's in consciousness of people, and people understand what it means, and yeah, why it's important.
Well, thank you very much, and I commend SCIDaR for all the efforts towards immunization.
Thank you.
Thank you very much, Raymond. I think we'll go to Tony now to round up this interview session. Tony, on to you.
Has been asked, so I won't bother to ask them again. Let me just ask, as the word mass you are
Tony,
I'm
I
losing
think
your audio.
your connection is not your audio. It's phasing in and out. It's not clear.
okay? Can I come again?
Yeah, please come again.
Can you hear me now?
Yeah, it's slightly
Hello?
better. You can try.
Can you hear me now?
Yes, yes.
Yes.
Okay. Okay. I asked, as the world marks World Immunization Week, how would you assess Nigerian current immunization landscape?
I would say it's one that continues to evolve. It has improved. I think just looking at numbers, I think looking at survey numbers, I think if I remember our 2008 survey, we're like some 30 something percent as a country. I think that's for Penta 3 coverage. I think currently we're 45, between 45 and 50 there, but I think 45% actually. So there's been some improvements, right? The improvement is uneven as we move state by state, depending on the different contextual issues for those states. We do have very strong political political leadership around it. The funding for it by the national government continues to sustain. The partnership needed for funding by national governments and our funding partners continue to sustain. So that's indicative of the fact that it's prioritized and all of that. Um, so I'll say it's one of progress, but like it's unfinished. So it will continue to improve. And I think over the next couple of years, we should see some improvement based on all the lessons we've learned and all of the players that are on the stage of this health sector and immunization landscape. So yeah, it is improving. We're still some way to go. We've learned a lot. There continues to be strong government and partner interests in immunization, and so yeah, there is. I'm optimistic about the future. It's not going to happen overnight, but there will be some improvements.
Okay, thank you so very much, ma'am. So can you just talk about some of the major gains Nigeria has recorded in routine immunization over the past few years? Just to write on the first question.
Major gains. I think there's been a few. Excuse me. I think the financing for vaccine continues to be a win for the country. It is financing that is ring fenced, that is secured for specifically for vaccination. So it ensures that the country continues to get the vaccines required for our population. I think that there's been, excuse me, gains in terms of also figuring out digitally what it means to track and find our underserved children. I think I highlighted earlier some work around identification and enumeration, which is really it's an arduous task. It's a hard endeavor, but the country realizes that it needs to be done and are doing the hard task because we don't have like census information in the country. It's difficult to estimate even the extent of success or to even identify where the bulk of our burden is. And so the country is doing the work of doing a house-to-house enumeration. I think it started in some initial 6 states, is expanding to 14, and it will continue to expand over the course of the year until we have the number countrywide. But what that helps us do is we're able to pinpoint which area, which settlement our problem is to the household of the child where that information was gotten, and allows like some almost in-person follow up at the health facility level once the data is disseminated to health facilities. Beyond that, there's some work to digitize. All of that is in progress. So I think there are a number of things, but as I said, for a lot of these things to materialize, like it's a lot of hard work has to be done, and that's a slow process. But once they start to bear fruit, if we stay the course, which I think we are doing, we should start to see success on them in a couple of years. I know that sounds far, but yeah, yeah.
Actually, okay, despite these gains, many children remain under immunized. What are the key challenges responsible for this gap?
I feel like I've addressed this. It's, as I said, it's like a mix of things. There's demand side, there's access challenges, there's system challenges that together sort of complicate how we interact with immunization services, depending on where we come from, whether it is the caregiver not understanding the benefit or the why of it, or not prioritizing it, or the fact that the vaccines are not made routinely available last mile because we're not tracking properly, although there's interventions now to try to address that. There's also our health worker shortage, as the burden of work means that they're not able to stretch to reach all of the settlement. There's access challenges of reaching the health facility, etc., etc. So it's a mix of things, but it's understanding the nuance of these challenges on a state by state, almost LGA by LGA level, and solving for them that will get us where we need to be. And so it's a all hands on deck approach that will get us there, because no one person, Nigeria is a big country, and we're a big country with like diverse contexts. And so it requires like everybody picking one part of it and like trying to solve it ultimately.
Okay, finally from me, what message would you like to share with parents or caregiver during this year's World Immunization Week?
What message?
Yes.
I think
Parents.
I think it's simple, right? It is that vaccines are safe. They continue to be the most effective, life-saving preventive service for health generally. Every child deserves the protection that vaccines are able to provide. Um, I would say that they should please take their children for routine immunization. They need to ask questions of the health worker, of the community-based health worker, etc., to be able to understand why it's their rights, to be able to understand what they're not sure of. But also, once they then understand, is to ask that they then also be champions and advocates for the vaccines to their own peers, to their community members, be able to get those children also vaccinated. Because when we vaccinate our children, we protect not just one child, we protect like our community, because the vaccines ultimately provide what we call like herd immunity, that protects like children or everyone in the community. So yeah, it's a responsibility that we should take seriously, and whatever questions we need answered to be able to get us there mentally, we should ask the question and get the answers for them.
Okay, thank you so very much, ma'am. And this will be all
Thank you.
from me. Thank you.
Thank you.
Over.
Okay, thank you everyone for the thoughtful questions. And Amina, thank you for your time and insights. This has been an eye-opening session, and we'll share the recording shortly after this session. And if there are any follow-up questions or clarifications, please, you can reach out to me. And we appreciate your engagement and look forward to seeing the stories that come out that come out of today, like come out of this interview session. Is any other person that wants to kind of give a closing remark before we leave for the day? Or yeah, Amina, would you like to give a closing remark before we leave?
Uh, yeah, I guess it's thank you to everyone on the call. Thanks for the questions. I hope that I'm grateful for the time and your interest in even speaking to Solina and understanding what it is we do and trying to keep the message for immunization out there. I think that's the burden of the media, and you guys are doing your part. So it's for us to do ours as well, to be able to connect the work you're doing with the work we're doing and ultimately change the landscape for immunization in Nigeria. So I'm thankful. Yeah, looking forward to what comes out of this. That's all.
Okay. Okay. Thank you very much, everyone. Thank you, Raymond. Thank you, Tony. Thank you, Joseph. Thank you, Fatima. And have a nice day. Bye, everyone.
Bye.
Bye. Thank you.
Bye
Yes.
bye. Thank you.
Bye bye.
Bye.
Thank you.
Yeah, thank you too. Bye.